So hello friends, I hope you are liking this series of educational videos which we have started on behalf of the Resolution Fetal Medicine Center. There are many aspects in fetal medicine which come across again and again, not only in the clinician's purview but also for the patients to wonder, what is this scan, why am I doing this, and what is the best way of doing it. So the NT scan has become an irreplaceable part of the antenatal care armamentarium for both obstetricians as well as patients. Now, what is an NT scan? Is every scan done in the first trimester qualified just by its gestational age to be called an NT scan? No. Every scan done in first trimester cannot be called an NT scan unless it has been done in the criteria that is prescribed for an ideal NT measurement. And this measurement is very important because it gives you a quantitative risk assessment for fetal aneuploidies. It gives you the risk for fetal structural abnormalities and opens the way to a lot of investigation in pregnancy. We now have Dr. Sahiti Reddy, Junior Consultant, Resolution Fetal Medicine Center, who will present to us the tips of taking an ideal NT measurement. This will be beneficial to young practitioners who want to know more about the scan, and it will also be useful for patients to understand why a certain scan has to be done with certain standards. So welcome to the world of resolution education.
Hello everyone, I'm Dr. Sahiti Reddy from Team Resolution. Today I'm going to take you all through a video where you assess fetus in first trimester, which is an important part. That is ideal steps of NT measurement. Nuchal translucency is a sonographic appearance of collection of fluid under the skin behind the fetal neck in first trimester of pregnancy. It is an important marker in first trimester to screen for fetal chromosomal abnormalities, structural abnormalities, and in NCDA twins to evaluate for early onset TTTS. When measured in standard way, it helps in planning individual screening strategies for aneuploidies and structural evaluation. Coming to the important part, how to do NT. The optimal gestational age is from 11 weeks to 13 weeks and 6 days, where the fetus measures about 45 to 84 millimeters from the crown to rump. The magnification of image should be such that the fetal head and upper thorax occupies the whole screen. A mid-sagittal section of the fetus must be obtained. In this section, the echogenic nasal bone and rectangular palate are seen separately. The fetus should be in neutral position with the head in line with the spine. Measurement should be taken with inner border of the horizontal line of the calipers on the line that defines the nuchal thickness. Important part is to turn down your gain to avoid the mistake of placing calipers on the fuzzy edge of the line. During the scan, more than one measurement must be taken, and the maximum one that meets all the above criteria should be recorded. Distinguishing between fetal skin and amnion and measuring the widest part is another important step in measuring the NT. Sometimes you may see the fetal umbilical cord around the neck, that is in about 5% of cases. This finding may produce a falsely increased NT. In these cases, you have to measure the NT above and below the cord and give an average measurement. So coming to the 3 steps that is important in measuring NT are orientation, magnification, and gain. You orient such that the fetus is in mid-sagittal section and in neutral position. You magnify such that the fetal head and the upper chest covers the whole screen, and you should turn down your gain to avoid the fussy edges. Thank you.
We will try and put in videos and explanations on a regular basis about certain issues that need more clarity. One of my requests will be for all of you to like and subscribe the channel, but also to give us some suggestions about what would be the issues you want us to address next. Come join with us and clear out the darkness of ignorance into the world of resolution education. Thank you.